Good afternoon, everybody. Yehudis Schamroth here, nurse anesthetist of 30 years and acupuncturist for the last 10 years of my medical career, combining the two fields of Western and Eastern medicine to provide you in the Ramat Beit Shemesh and Jerusalem area with alternative complementary healthcare. Every week I do Wellness Wednesdays. It's a webinar where I discuss important health topics, including inflammation, autoimmune disease, brain health, etc., exercise, fitness, diet, everything you might think of that has healthcare discussions, and much, much more. And if you go to the YouTube channel, RBS Acupuncture and Yehudis Schamroth, you could click the like button and comment, and feel free to suggest any of the topics you'd like to hear more about. This week's topic is on the lymphatic system, and it's inspired by a friend of mine that was here visiting from Las Vegas, Becky Pepkowitz, very dear friend. And Becky has a lot of lymphatic issues, and she was describing in detail to me on how valuable her lymphatic treatments were and how it made her feel so much better. And it got me really thinking that a lot of us don't really understand what is the lymphatic system anyway, what purpose it serves us, what does it do for our bodies, and what happens if it doesn't work well. So let's talk about that for a few minutes that I'm here with you. I'm going to share the screen. And today's topic again is the lymphatic system. What is it and how does it work? Good question. Oopsie, I lost you. I'm sorry. I'm really not technical. There we go. This is what I wanted to do. Okay, let's talk a little bit about the lymphatic system. So we know the lymphatic system is part of your immune system and has many, many functions. It's like a third type of circulation in your system in addition to the regular circulation, which is your arteries and your veins. It travels alongside in parallel with the regular circulatory system, but has very, very different functions. Everything ranging from controlling body fluid to protecting us from illness-causing invaders, absorbing digestive tract fats, and removing cellular waste. So any kind of blockages or diseases or infections that can affect our lymphatic system's function can cause a lot of problems. So we do know the lymphatic system is a network of tissues, vessels, and organs that work together to move the lymph back into your system. So what is lymph anyway? The lymphatic vessels will absorb the excess fluid in your tissues, and they transport the fluid, which is now called lymph, to the ducts and drains in the veins. So when the circulatory processes go on in the circulatory system, we know the main function of the circulatory system is to deliver oxygen and nutrients to the tissues. But then some of the fluid spills over to the interstitial spaces, which is what the space in between the cells are called. And in that time where the fluid is in between the spaces of the cells, the lymph gets busy clearing it out, taking out the big tissue pieces, clearing out any toxins, and then delivering it back into the system for us, for our function. So again, it transports the fluid, and that's initially formed by the blood, and it transports absorbed fats from the small intestine, and it produces cells called lymphocytes, which help us protect us, producing white blood cells, helping us fight infection. So we know that there are 20 liters of plasma or so in our body at any one time, and it's in our arteries and our veins, and it goes all the way down to our smaller vessels called capillaries. And after delivering nutrients to the body, the cells have to have their waste products removed. So that's where it happens in the interstitial spaces, and this extra fluid turns into lymph, but it has to go back into the system. Otherwise, we have something called edema, or excess fluid buildup. So the lymphatic system does not have a pump system to it like the cardiac system has with the heart. The lymphatic system is just a whole series of different little nodules in different places of the body that collects the fluid. And it's very complicated, but in simple form, this lymph that flows through our body that came from the tissues that's being filtered, there could be like 3 liters of this at any one time. It goes from our tissues. It ultimately gets returned to the system, but it has to do it by on its own. Basically, there are sensors, stretch receptors in the lymphatic system that when they're stretched, the blood vessels stretch, they know to sort of push and move the fluid back. But it's a unidirectional system. Unlike the cardiac system, where you can go up and down with the different valves and a pump with the body pump by the heart. But the lymphatic system doesn't have a pump. It has to rely on the muscles that contract and the blood vessels that stretch. And if you have a problem with contraction of your muscles, or if you're sedentary, or if you have had surgery and or had some kind of dysfunction to your lower extremities, especially, it's very difficult for the fluid to travel back up to the heart. So that's why it's very common when we see people with what we call pedal edema or edema of the ankles for any reason we'll talk about in a few minutes. But so in a nutshell, the lymphatic system is a drainage system. It removes excess fluid from our body and returns it back to the bloodstream. So it has also consists of a system of glands, which I'm going to outline here. We have lymphatic glands, we have ducts. The ducts are similar, it says, to the vein walls, and the ducts eventually do empty into the thoracic area, into the chest, into the right or the left, and back into the cardiovascular system, and that's how the balance is made. So if it doesn't get dropped back into the system, it has to go way up to the heart. There's this fluid that has to travel upwards against gravity, so it's very difficult to maintain that if you're not in good health. Talking about the different system, here's the arterial system, just a simple view. The arterial being the red and going to the heart and oxygenating the blood and pumping it back. A venous system dumping into the heart, becoming oxygenated, the arteries delivering it to the system. And then in between is all that whole network of this fine mesh of network of a system called the lymphatic system that collects all the debris, basically, and all the excess fluid and toxins that we breathe in and ingest, and also toxins that are byproducts of our metabolism. And again, we know too that the lymphatic system has larger pores, so it allows for transportation of fats from the digestive tract. It's excess fats and proteins, and transports them back to your bloodstream as well. And then, of course, the immune function again is there's antigen cells and their lymph nodes in different parts of the body, along the neck, underneath the armpits, in the groin area, all along the body. And anytime there is any problem with the lymph, it's going to be in any one of those gathering areas. So again, it's unidirectional, and it relies on the integrity of the muscles and veins and arteries around it to push the fluid back up to the heart where it belongs. It's really crucial that the lymphatic system is working properly to prevent any backflow or any fluid accumulation. And again, so the parts of the lymphatic system are, of course, the lymph itself, and it's called lymphatic fluid. And it's a collection of extra fluid that drains from the cells, and it's not reabsorbed until all the toxins are removed. So the other substances that get collected all along the way are proteins, minerals, fats, nutrients, cancer cells, and foreign invaders like bacteria, viruses, etc. And the lymph transports infection-fighting white blood cells, which are the lymphocytes. And again, the lymph nodes are found all along the body. They're little bean-shaped glands that monitor and cleanse the lymph as it filters through them. And the nodes filter out the damaged cells and cancer cells. They also produce more lymphocytes and to help the immune system attack and destroy bacteria and other harmful substances. And more, as I mentioned before, these locations of the lymphatic system and these little bean-shaped nodules are prominently found in the neck and in the middle of the abdomen and underneath the arm, and also in the groin area. And this again prevents edema by getting rid of the excess buildup. There are organ systems that are. Here's the picture and a depiction of the of the network of the lymphatic system. It travels along the circulatory system, and it looks very different from the circulatory system. You can see it doesn't have veins going out and arteries going back into the heart. These are just like a little network of fine mesh collection of little nodules here and there that it's such a fine collection that it's very barely seen. And if you do a dissection, it's almost impossible to see without the microscope. So we see it in the armpit, the appendix, of course, bone marrow. I'm going to talk about these in a minute. There are places of lymphatic tissue in the small intestine, the thymus gland, the spleen, and the neck, and the thoracic duct. So here are the glands that have lymphatic tissue in them. And it's, again, the spleen, the thymus, the tonsils and adenoids, bone marrow, the Peyer's patches in the small intestine, and the appendix. So just briefly, the spleen is the largest lymphatic organ we have. It's located on your left side, under your ribs, and under your stomach. The spleen filters and stores blood and produces the cells that fight infection. That's the lymphocytes, the white blood cells. The thymus is an organ that you find it's located in your upper chest beneath the breastbone, and it matures at a specific type of white blood cell. that fights off foreign organisms. You have tonsils and adenoids in your neck. Kids have them removed frequently because they get infected a lot. And that's because the kids are together. They give each other infections constantly. And over time, the collection of, it's like junk left over from all the infections, all the white blood cells, red blood cells, everything that has to be carted away as toxic substances from the body do collect in these lymphatic organs. So over time, when they've been overly used, let's say, it's like with children who are constantly exposing each other to infection, it's sometimes they become very, very large where the kids get sick all the time. They can't swallow, and they have to have these tonsils removed and their adenoids as well. So they trap because they trap the pathogens. And so when they get so large, they cause problems and they can't breathe well and you have a sore throat or whatever, it's better to take them out. We can also find lymphatic system in our bone marrow. It's a soft, spongy tissue in the center of the bones, especially in the hip and the breastbone. And white blood cells, red blood cells, and platelets are made in the bone marrow. So these are all things to help us with our immune system to help fight infection. Peyer's patches, they are small masses of lymphatic tissue in the mucous membrane that lines your intestine. The lymphoid cells monitor and bacteria, and this is part of our lymphatic system that helps us the most with our immunity. They used to think the majority of the immune system, of course, was all over different parts of the body spread out equally, but now they know that the small intestine is really where at least 60 to 80% of the immune system resides. And it behooves us to take very good care of our digestive system, keeping it healthy, keeping it strong, and taking care of our good bacteria count, keeping it better than the bad bacteria count by taking probiotics especially. So keeping your digestive system in order is a great way to protect your immune system, as we've mentioned in many webinars. And then finally, the appendix is a lymphoid tissue, they call it, that can destroy bacteria before it breaches into the intestine. So the appendix tries to also act as a trap for bacteria and parasites and fungi and things like that. So it really also does play a role in good bacteria for the intestines, and we can live without it actually. But it's good to have your appendix because it's a very good collection of pathogens that we can get rid of without causing any illness. It does automatics for us as our whole body does. So just in general, just as a recap, the entire circulation system is the veins and the arteries, and the lymphatic system is part of that. And it filters all the blood and the fluid that's trapped in between tissues, and it dumps it back into the circulatory system again after it's cleaned. It is a system to prevent fluid retention and works on the basis of internal sensors that get activated by the stretching of vessels and also the pump, the squeezing of the muscles when we exercise. So again, because there is no pump, so our lymphatic system relies on the integrity and the health of the lymphatic stretch sensors and the muscle contractions to continue proper flow and prevent edema of the tissues. And what happens? What is edema anyway? Edema, before I talk about this, I just want to mention there's a lot with the lymphatic system that can be discussed, really. We know we can get enlarged nodes. Again, we talked about that with kids. We can have lymphedema. Lymphedema is a big problem with people. It's a result of blockage of the lymphatic system caused by many, many things, scar tissue surgeries, things which I'll talk about. You can have cancer of the lymphatic system, which is called a lymphoma. Like you've heard of Hodgkin's lymphoma. Cancerous tumors can block the lymph ducts also. It's a very dangerous situation. It's not only cancer, but it also can block the lymph flow and can cause all kinds of problems with a person's ability to protect themselves from the immune system, destroys the immune system, and along with the chemotherapy also. But in addition, you can't do any kind of body purification, even though the liver can be very strong. For detoxing, you still have a lot of purification that happens in the lymphatic system. There are a lot of other issues too that can happen with the problem with the lymphatic system. It's not so important to discuss these right now. There are different diseases that are overgrowth of lymphatic system called Castleman disease. There's a rare lung disease called lymphangiectatomatosis. There's autoimmune disease of the rare genetic disorder where there's a high number of lymphocytes. There is inflammation of the lymph nodes that can happen in the abdomen, and tonsillitis, of course, we know about that. So those are things that you will go if you have any kind of symptoms at all in your lymphatic system, and I'll go over what that means. Mostly starts with edema. So edema happens when your small blood vessels leak fluid into nearby tissues, and that extra fluid builds up, which can make the tissue swell. And it can happen almost anywhere in the body. We're just so used to seeing ankles being swollen, especially, but it can happen in the hands. It can happen everywhere. You can have something called peripheral edema that's along the legs and feet and ankles. It can happen in the arms, especially post-operative from breast cancer surgery. It can be a sign of problems with your circulatory system, your lymph nodes, or your kidneys. You can have foot edema, which is called pedal, P-E-D-A-L, pedal edema. It happens when the fluid gathers in your feet and lower legs, and it's more common if you're older, if you have cardiac issues, or if you're pregnant. And it can make it really hard to move around. It can be very painful. There's something called pulmonary edema. That's when fluid collects in the lungs, and that's a big problem. Also, it makes it very hard to breathe, and it's worse when you lie down. And if you have symptoms of feeling like you have gurgling in your chest, a fast heartbeat, you feel suffocated, and you're coughing up anything that looks a little bit foamy or frothy, go to the doctor immediately. And again, you can even just call 911. This is a real serious condition. There's edema of the eye. It's called macular edema. It happens when fluid builds up in your eye, and it's in the center of the retina. The macula, which is in the center of the retina, gets very overloaded with fluid, and it can cause a lot of damage to the retinal artery and vein. So, again, edema occurs when the tiny blood vessels leak the fluid. We do see edema, which is a natural response to the immune system, by the way. If we get a bee sting, we get a lot of puffiness. If we get inflammation, we have a lot of puffiness. If you have a low albumin is protein, and protein is what keeps the integrity of the tissues together, including the lymphatic system. So if you're low on protein, you might find that out in a blood test. It's called hypoalbuminemia, and you can test that in a regular blood test. Edema is part of most allergic reactions, so you'll see it in any affected area with some allergy, and we can see it with burns, life-threatening infections, congestive heart failure. There can be liver disease, kidney disease, all different terrible organ diseases can exhibit as a symptom edema somewhere. I'm sorry, somebody's jumping on a trampoline above me. If you have a head trauma, you're going to have edema, a swelling, and of course, they call the cranium a closed box. So if you have swelling of the brain, it's going to start puffing out. There's nowhere for it to go because of this enclosed cranium, and the brain starts to press downwards because there's nowhere else for it to go, and it causes brainstem compression, and people can stop breathing and their heart stops. So head injuries, it's very, very serious and causes that kind of terrible edema that you have to treat immediately. How do you tell if you have a problem with your lymphatic system? These are some health conditions which could suggest your lymphatic system requires some serious cleansing, and we can talk about that. We have arthritis, that's puffiness and edema of the swelling of the joints, and that's autoimmune diseases and also inflammatory. A lot of these are hand in hand with inflammatory. Skin conditions like eczema, psoriasis, digestive disorders like irritable bowel syndrome. Even this can be a sign of poor lymphatic drainage. If you have frequent headaches, frequent sinus infections, unexplained injuries, excess weight, and chronic fatigue are also commonly seen with people whose lymphatic systems are very, very sluggish or really need to be cleansed. And again, I'll talk about that. And if you have an inadequate lymphatic system, it's because there's some damage. So you have to address that as well. And if you have, like again, I mentioned before, if you have a long-term protein deficiency, and that's very rare, but you can cause edema because the protein is what keeps the fluid involved enclosed in the tissues. And if your protein is lacking, there's no way for the fluid to stay. It's like, it just flows out too freely. There are medications that cause problems with your lymphatic system, including NSAIDs, calcium channel blockers, birth control pills, things that cause swelling and fluid retention. We all know about those. And you can see mild cases of edema also from sitting and staying in one position for too long, like when you're on an airplane, eating too much salty food, or having premenstrual problems. Women get a lot of bloating around their tummy. So this is all types of edema, all types of fluid retention, and things that are all part of a disruption in the lymphatic system. So the typical type of fluid buildup we see, of course, is in the legs and the feet. We talked about it already, but here's a little bit of a better representation where the lymph flow, you can see there's constriction. So the lymph can't flow back up because there's some restriction. And it can be due to many, many causes. You've got a problem with your protein, if you have a cancer, or if you have, if you have surgery, or if your cardiac status is poor. So we do know that leg edema can be related to congestive heart failure. That's a whole different discussion. But you might want to go on a diuretic. The doctor will put you on what they call a water pill, and you can drain that excess fluid away. But barring the fact that people don't all have cardiac illnesses, there's something that called lymphedema, which we mentioned before. And lymphedema is just a collection of fluid and edema, excess fluid in the tissues from some other cause. So again, the risk factors could be just very simple ones, like normal risk factors, like being pregnant. Your body retains more sodium and more water, and because of the fetus and the placenta. If you're on steroid drugs, if you're on estrogen drugs, high blood pressure medications, as I mentioned, and a chronic illness, any kind of chronic illness is going to cause very big damage to the lymphatic system. So if it's untreated, edema can cause increasingly painful swelling, difficult walking, stiffness of stretched skin, which can become itchy and uncomfortable. Increased risk of infection, because if you have swollen tissues, you're going to have much more chance of getting infected. Scarring between the layers of the tissue, decreased blood circulation, and decreased elasticity of arteries and vessels and veins, decreased elasticity of joints and muscle. You see that with arthritis, and you see an increased risk of skin ulcers. So edema is not only painful and difficult, make it difficult to walk, but it affects all your different functions of your life in your body, and it has increased risks for all kinds of other problems. So how can you keep your lymphatic system healthy? Here's just an example of what edema looks like. I'm sure everybody's seen it. There's something called pitting edema. If you put your thumb in there and it doesn't come out, again, that means it's such a collection of excess fluid, and we have to figure out why. This is a picture of a person who's got an extreme case of lymphedema and fluid collection in her legs. So how can we keep our lymphatic system healthy? Well, here are the signs of a clogged, let's say, here are signs of a clogged system. We know we want to get rid of the toxins and the fluid accumulation. So how do we do that? It's likely to get clogged if you're older, so you have to be careful to eat healthier. I'm going to go mention that about foods. We know that our lymphatic system removes the interstitial fluid from between the tissues and absorbs the fats. We know all that stuff we've done. But the lymphatic system is out of balance with people with nutritional deficiencies. If you take a high intake of processed foods, a lack of physical activity, and other health conditions like arthritis, skin conditions, digestive disorders, frequent headaches, sinus infections, unexplained injuries, excess weight, and chronic fatigue. I mentioned those before. If you have any of those things, you probably have some kind of stagnation in your lymphatic system. So let's think of at least 5 ways to treat swelling in our body, and let's focus on the legs in particular because we see that more than anything else. So the first thing we're going to see is, of course, elevation. It's very simple. You can elevate your legs. You notice that your feet might be small in the morning, but by the end of the day, like the fluid just continues, the gravity continues collecting more and more fluid. And as the day goes on, if you have a problem with your lymphatic system, you will see that your feet are swollen by the end of the day. You could be a young, healthy person. As a nurse, I had many days where my feet were swollen after working for like 2 double shift or something like that. And people who are standing cooking for many hours, like a lot of us ladies do in the kitchen. Elevation is the best way to treat this, and if you're a very young, healthy person. So just don't forget that when you get home, to elevate your legs for at least 20 minutes, and you want your legs to be equal or above the level of your heart. You should give your lymphatic system and your heart a rest every day if you're on your feet a lot. Exercise, of course, acts like a pump. It helps pump the lymphatics back to the heart. So if you have any fluid buildup in your leg and you feel like you're getting a little puffy and the elevation isn't helping, go for a walk or just walk around your house, do some stretches, do your chores around the house to get that fluid moving. In some extreme cases, we have to take medications. Diuretics, as I mentioned before. If the patient is a cardiac patient, especially, you will see people on cardiac medications to make them go to the bathroom more often, excrete urine much more often to get rid of some of that excess fluid. Also, there's some diets you can take that are like the diuretic types of diets, and also people who have glaucoma, who have a lot of pressure in their eye, they take medications to help decrease the fluid buildup in their eye. That's another type of swelling that we find abnormal. We want to treat with medications. There are herbal medicines too out there that are plants that are natural diuretics that you can take as well. You can talk to someone like me And I can give you suggestions on what you take that's a natural form of medication. Compression is something that people don't like to talk about because they hate those compression stockings. I talk to everybody. I recommend to everybody who's got leg edema or swelling, even occasional swelling, wear compression hose. And they're like, no, I don't want to wear it. It hurts. It's a pain to get on. I can't even do it by myself. But there are ways to do it. So it's a little more gentle on the body and a little easier to put on. You don't have to have your partner put them on for you. You could just use regular ACE wraps, which are a lot easier to manage, and elevating your leg. And by the end of the evening, it's just wonderful. And there are people that are experts out there called lymphatic drainage experts, and they know how to wrap the leg to help decrease. Because as you should know, that the stockings are really not meant to shrink your legs. Stockings are not there to shrink your legs. The stockings are there to just reduce the swelling. And so what you want to do is daily wrap your legs in a very consistent way, in a very gentle pressure way, so that you can get them as small as possible. And then you can move to the stockings, which are actually supposed to be more maintenance for you. The stockings are not cures; they're maintenance. So you have to know that you can get your legs down to a manageable level where the stockings aren't such a hassle anymore. And here's an example of a leg being wrapped up for lymphatic drainage. Daily, by the way. Okay, I wanted to talk just a little bit about manual lymphatic drainage. I'm no way an expert about this, but I know a little bit about it. And this is one of the things my friend Becky was saying was so magic for her. She said she got treated twice a week. She gets treated twice a week. It's a very gentle massage. It's not a full body squeezy massage like you might imagine. But there are certain ways to gently push the fluid from the affected extremity back up to the closest possible lymph node. So if you have edema in your feet or legs, there's gentle massage pressure to go up to behind your knee. If you have swelling of your whole entire leg, you can keep moving your hands gently up to the groin area where there's big lymph nodes that can collect the fluid. And you do them over and over and gently upwards, and like 10 or 12 times, a few times a day. You can have your friend, your mother, your wife do it, your husband, do it yourself. There's self-massage, or you can go to a professional for this kind of drainage. And what your goal is to gently push the fluids up to where they belong, where they can be reabsorbed. So in this example, if you have swelling in the face, I do this with people with acupuncture for facial rejuvenation. We want to make sure the swelling leaves the face, and that makes people feel more healthy as well, and look more bright and look younger. So we want to push it down gently down to the clavicles, a big collection of lymphatic cells that will absorb that fluid right away for you. Like you see the arrow on this, you're starting down below and pushing gently. This lady is gently with the palm of her hand pushing upwards. You can either push down to the groin, or you can push upward to the axillary area. I was doing a little research on this, and I realized that surgically speaking, I just want to make a mention. I hope I can find that page. Where's my section on the surgery? I hope I didn't erase it, because sometimes that's what I do when I'm going through my stuff. I erase something real important. But this is one of the ways the lymphatic system can be disrupted is surgery. Surgery can be a big reason why people have lymphatic problems. Okay, so we know that swelling is going to be a complication of any surgery at all, whether it's going to be eye surgery, especially your facial surgeries. People get a lot of puffiness. Brain surgery, the brain swells, as I mentioned before. Total knee replacements, you see a huge amount of edema in those people. Cancer patients with breast cancer, blood clots in the legs. There are all kinds of reasons why the lymphatic system can get blocked up from a surgery, any kind of cutaneous plastic surgery. And what happens is again, also with hand reconstruction, I've seen hands just swell up really 4 times the size. So some of it is expected. You're expected to see some kind of swelling as part of the normal inflammatory process, but because it's a universal response to injury. But if it gets too much, you have hematoma formation, and you can get infections, and so edematous that the blood vessels get closed up, and you don't get good blood flow to the area either, and it's detrimental for healing. So it's excessive. If it's excessive, you're not going to heal well. And the more damage that happens, the more the edema happens too. So it's a real catch-22 situation. Just wanted to mention that. So I found this video, which was very interesting, and this knee surgeon was saying that the patients who have the best chance of having little or no edema is people who have lymphatic massage before surgery, 2 or 3 times a week before surgery. And you can see it's very difficult to see in this picture, but you see there are arrows that pointing to the lymphatic areas, and the massage is directed to gently move that fluid to the neck, move the fluid underneath the arm, move the fluid to the collarbone, move it to the groin area and the internal organs, and behind the knees. You can do this several times a day, 3 times a week before you have any kind of surgery. And the surgeon was saying the results were phenomenal. That it's like a best kept secret out there that lymphatic massage is really crucial for so many surgeries that should start even before surgery begins, and of course afterwards as well. So moving on to foods that promote lymph flow. Okay, we know I don't even have it on here, but protein, of course, is a big thing. And we said if you have a lack of protein, there's no integrity of the tissues, and they just leak fluid out like crazy. So you have to have enough protein in your system for integrity of the lymphatic system, the blood vessels, and many other reasons, of course, to have good protein, blood formation, and bones and teeth and hair and everything else. So you want protein in your system. You want to keep the system clean and flowing. So you're going to eat healthy foods. You're going to eat whole foods, and you're going to eat foods that are not processed. You want to make sure that they're not full of toxins. You want to keep the bloodstream healthy. So, and how do we do that? We're going to eat healthy. We have our proteins. We have our low sugar fruits. Green leafy vegetables are good for just about everything with all the nutrients and vitamins. They eliminate toxins, these green leafies. That's what's so wonderful about them. And they are full of vitamin A, C, and K, and B vitamins, and some protein too. Like you take something like a spirulina supplement that's got the highest amount of B vitamins you can get and the highest amount of plant protein in anything. And it's just a wonderful way to supplement your diet and eat very clean, as they say. Avocados, almonds, cranberries, walnuts, garlic, and ground flaxseed. These are all known to promote lymph flow. What else? Okay, you can improve your lymphatic health by avoiding processed foods, conventionally raised meats. You should go organic if you're very concerned, or artificial sweeteners that could cause a lot of damage to blood cells and lymphatic cells as well. Conventional dairy isn't so good. If you could eat organic or grass-fed animals who produce dairy, that's ideal. Avoid soy, because soy products are not good. I mean, I love soy products, so if I had a lymphatic problem would I avoid soy. And again, we know that excess salt will cause fluid retention. We know tell cardiac patients that for years now, and everybody else who wants to try to get rid of some fluid retention, like women who are menstruating and pre-menstruation. Whoopsie, long one from last week. Herbs that can help us in our lymphatic system is echinacea, astragalus, wild indigo, golden seal. These have many other functions as well, but cilantro, pokeroot, and parsley. These are teas that can help stimulate the lymphatic system. And in addition to, there's some raw foods I don't have mentioned here. I do. Chia seeds are all good. So you just want to keep your lymphatic system strong and healthy. Do regular lymphatic massage, lymphatic drainage if you can. And again, there's this whole idea too that we're always, all day, every day being assaulted by toxins in the world. And it's just, if we can try to find a way to stay away from anything toxic, anything from shampoos to cleaning products to pollution in the air to additives to foods, it's very difficult for us to avoid toxic substances. But there's a big movement to detox. And a detox, I've done a few different webinars on that. Do we detox? Do we not detox? It's normally speaking, our body can detox itself very, very well. But if you can't, if your body's not in good health, you're not detoxing well. So you do have to eat properly, and you do sometimes have to get lymphatic massage, and you do want to do other things, eat clean, eat organic, any of those things that can really help your circulatory system in general, your whole body in general, low sugar, anything that causes creates good health in your system is going to help your lymphatic system as well. And a couple of other things that are recommended for your lymphatic system function is to take hot and cold, alternating hot and cold showers at the same time. Hot and cold and hot and cold. It sounds a little crazy, but what it does is the cold water will constrict and the hot water will dilate. So that causes like the pump action. And I mentioned before, the lymphatic system is unidirectional and it doesn't have its own pump. So you have to sometimes help it out. And doing nice massages on yourself is a great thing to do, starting from your legs, your ankles up with your hands alongside, just gently moving up with your hands on either side of your leg is really, really helpful. Do that every day with elevation. There's something called dry brushing. We do that with kids who have tactile defensive disorders, or they're afraid to touch things, and brushing the skin with a regular soft hairbrush is really it stimulates the skin, stimulates the nervous system, and it's actually very calming for the children. But for the lymphatic system, it helps move it along very nicely. Drink clean water, of course, and avoid wearing tight clothes, and take your deep breathing. And again, watch your toxicity levels. Try not to expose yourself to too much toxicity in the world. You could take, there's a lot of vitamins you can take to cleanse your system without having to go on a cleanse. If you want to talk about how to go on a non-cleanse, please contact me at RBS Acupuncture. I'll put that up here right now at gmail.com. You can write to me and I'll be super happy to make some recommendations about how you can cleanse your lymphatic system and your body in general without going on a very harsh cleanse. Without further ado, I think I will just stop here, because that's the lymphatic system in a nutshell. And I hope you enjoyed, and I enjoyed presenting today. And if you have any questions, please contact me. Don't hesitate to contact me. I have a website. It's very nice. It's rbsacupuncture.com. I have a lot of good blog articles on there and descriptions about how acupuncture, Chinese medicine, can complement Western medicine very nicely. I have any questions about that as well. And have a wonderful day. Have a wonderful week. A nice, healthy week. We'll see you next time.